Go ahead and lie on your back or sit in your chair and take a moment to sense yourself. Just check in overall with how you're doing in this moment and where your attention is naturally going or flowing. And this is also something, what we're going to do now is something that can be done in bed, in the process of going to sleep, or also if you wake up in the night and you want something to help you a little bit to go back to sleep, you can revisit this at some point. So just pay attention now to your face and any sensations that you have in your mouth, your jaw, without trying to change anything, but just noticing your face, your mouth, your jaw. And then a little bit begin to open your mouth and then close your mouth again. And go super gentle, super slow, super delicate with yourself. So nothing extreme, nothing forcing or stretching. Just seeing how you easily open your mouth. And as you're doing this, you might notice, is your mouth opening exactly in the middle, or is it a little bit more veering towards your left hip joint or your right hip joint? And then just pause. And you can have your knees bent or your legs long, and you can go back and forth with that as well. And then roll your head a little bit from one side to the other, just going the amount that's easy and the direction that's easy. If one direction's not so easy, then maybe you don't go all the way there, or you just think of going in that direction. So stay with what's easy. And then stay now with your head a little bit more to one side. Doesn't need to be extreme. It could be just a millimeter more to one side. And then open your mouth and close your mouth. And notice the change in gravity, in relationship to gravity, just having your head a little to the side. Does it change the direction of your jaw? Or how you sense the movement? Come back to the middle, pause. Roll your head the other way a few times. And then stay there and then open and close your mouth. What's different about having the head a little this way and doing this movement? You might notice some changes in the breathing spontaneously or some other noticing elsewhere in yourself. All right, come back to the middle, pause. And just see from this so far, anything different in the face, in the jaw, in the mouth, or in yourself overall. Return to your attention on your mouth, your jaw. And this time, open your mouth just a little bit so that there's a little space between your teeth. And then take your jaw a little bit forward. So it's kind of like you were going to bring your lower teeth in front of your upper teeth, but don't go so far, don't go so extreme. Just in the direction what's very easy. Forward and then return. Pause. With these movements, you can make them so small so that if somebody were seeing you, they wouldn't be able to even see that you're moving. They can be very small. You want to be very gentle with the jaw. Okay, so now open your mouth a little bit how you do. Open and close your mouth. And then keep your mouth open and now take the lower jaw, take the jaw a little forward and return. And just see if starting out with the mouth just a little bit more open, if it changes the forward movement. And then make the space a little smaller and then do the forward movement. And compare the difference between having the space, the mouth open a little smaller or a little bigger when you do the forward movement. And then pause, let that go, rest. Bend your knees again. A few times roll your head a little bit one side and the other until you decide which side is more comfortable for you to have the head. And then you keep the head a little to the side and then open the mouth just a little bit and take your jaw a little forward. And this position, which changes the direction, right? So it's now like this diagonal, not just straight across the sternum, or maybe it wasn't before, but you just go in the direction of forward with your head turned. You can see how open or how closed you want the mouth when you do this movement of the jaw forward. And when you let go of the movement, let it return all the way so that you feel that you can pause in between each movement. You might notice something lets go in the pause, something lets go in the shoulder or the jaw, or maybe the head rolls and slightly different wants to be in a slightly different position. You let that happen in the pausing and then return to the middle, rest. A few times roll your head in that direction that you just went. And then a few times roll your head in the other direction. And then stay there with your head in the new direction. Take your jaw a little forward with whatever amount of opening you want of the mouth. Just looking for that sweet spot. So it's not too closed, not too open. Just looking for where there could be a gliding of the jaw forward. And then when you return to neutral, you let it find its letting go place. And you might notice it's also in the going forward, maybe it's not a straight line. It might be like a little wiggle. And then in the returning, it also might have this little not straight line back. All right. Pause in the middle. Roll your head back to the middle. Roll your head right and left. See how that is for you now. And then just in the middle, open your mouth again and close your mouth. Notice if it's any different. And then let that go and just check in with any changes that you're aware of in your face, your mouth, your jaw, your breathing, your contact with the floor, or your contact with yourself. And you can stay here resting on the floor or in your bed or in your chair, wherever you are. You can let that be the end of the lesson, or if you want to come to sitting, come to standing, and let that be the end of the lesson. You can choose your own end or beginning.